The Senate Committee on Health, Education, Labor, and Pensions will please come to order. This hearing is for reviewing the Opioid Crisis Response Act of 2018, which Senator Murray and I have recommended with input from virtually every member of this committee. Our intention is to mark up the bill and report legislation to the full Senate on April 24th, along with cosmetics legislation and some other pending bipartisan legislation that we've been working on. I want to thank Senator Murray and her staff and our staff for the way we've been able to work on the opioid legislation. This is our 7th bipartisan hearing since October. I think our work reflects the urgency of the need for a prompt response to our country's most serious public health crisis, which despite enormous efforts seems to get worse. Senator Murray and I will each have an opening statement, and then we will introduce the witnesses. After the witnesses' testimony, senators will have 5 minutes for a round of questions. Last week, I was in Tennessee visiting the Upper East Tennessee area. I was talking with our witnesses beforehand. I met with 2 of the 4 criminal judges in the Upper East Tennessee area, who told me that out of the 6,000 cases that they addressed and closed last year, that fully 2/3 of them were related to the opioid crisis. And then a little later in the day, I went down to Greenville, Tennessee, to the home of Andrew Johnson, President Andrew Johnson, and his upstairs bedroom is his son's bedroom. And there on the bedside table is a bottle of laudanum. And his son, at age 35, died of basically an opiate overdose, probably mixed with alcohol, even back then. So this is a severe crisis, and it's not a new phenomenon. Last week also, I visited the neonatal intensive care unit at Niswonger Children's Hospital in Johnson City, Tennessee. The hospital opened a new separate unit within their NICU last May to help deal with all the infants being born in drug withdrawal. Of the 30 babies in the unit last week, 10 were in drug withdrawal. The babies stay in the hospital for at least 5 days. Some stay for weeks. While at Niswonger, I heard heartbreaking stories of how the opioid crisis has claimed the lives of loved ones too soon. One story is about a man named Dustin Iverson. After serving 2 tours in Iraq and Afghanistan with the Mississippi National Guard, Dustin settled in a small town in Alabama. A year and a half ago, Dustin was found dead at 29 years old from an apparent overdose. His death turned a national crisis from a news headline into a painful personal experience for his Aunt Trish Tanner. Trish is currently the chief pharmacy officer at Ballad Health, a regional health care provider. She was enrolled in an executive fellowship program when Dustin died, and as part of her program, she worked on an in-depth project on ways to reduce opioid prescribing. She has said about the project, "I researched the opioid crisis in our region. As Dustin's aunt and as a pharmacist, I have a duty and a desire to bring about change now. This is a way for us to redeem what has been lost." As a result of Trish and her colleagues' efforts, the health system she was working for at the time, now part of Ballad Health, reduced the number of inpatient opiate doses administered in its hospitals by more than 40% last year. In January, Sam Quinones testified before our committee that we need a moonshot to solve this crisis. I think it may require the effort and resources of a moonshot, but I also think it'll be different and harder than a moonshot because this is not something that can be undertaken by a single agency in Washington, D.C. It will require an all-hands-on-deck work and solution from states, communities, and local partners. However, the federal government can and should play an important role. Last Congress, we passed new laws, the Comprehensive Addiction and Recovery Act and the 21st Century Cures Act, to help address the crisis. In the last 3 years, we've provided additional funding targeted at easing the opioid crisis, including $1 billion in state grants in cures over 2 years, and over $3 billion of additional funding in the omnibus bill we passed last month. But the opioid crisis continues to destroy families and communities, so we need to examine what more we can do and make sure we're the best possible partner. In December, Senator Murray and I wrote to every governor and state insurance commissioner asking for ideas on how we could do that. And this committee spent the last 6 months hearing from governors, state officials, doctors, officials from the Food and Drug Administration, National Institutes of Health, Centers for Disease Control and Prevention, the Substance Abuse and Mental Health Administration, families, other experts at our hearings. As we've heard, this crisis touches more than just those suffering from an opioid addiction. It touches children and grandparents and doctors and nurses and law enforcement. And so the response from the federal government must be bipartisan, urgent, and effective. Last week, Senator Murray and I released this draft legislation based on the input we've heard, as well as ideas from senators on both sides of the aisle, to give new authorities and create grants and programs at 6 federal departments and agencies. So far in this draft, there are 29 proposals from nearly every member of the committee, including legislation introduced by Senator Murray, Young, Hassan, and myself to spur development of a non-addictive painkiller by giving the National Institutes of Health more flexibility. I see a non-addictive painkiller really as the holy grail of solving the opioid crisis. There are millions of Americans who suffer from chronic pain. I've heard from many of them. They rely on opioids for relief. Developing new non-addictive ways to treat is crucial to helping prevent people from becoming addicted to opioids while ensuring those who need relief have access to it. Our proposal would also give the FDA the authority to require drug manufacturers to package certain opioids for a set duration, like in a blister pack that contains medication for 3 or 7 days, and require manufacturers to give patients simple and safe ways to dispose of unused opioids. It would also help do a better job of stopping illegal drugs, such as fentanyl, at the border by strengthening coordination between the FDA and the Customs and Border Protection. At our hearings, we heard about the importance of sharing data and how sharing data would help state prescription drug monitoring programs. So this draft would help states collect and share data so doctors and pharmacies can know if patients are doctor shopping. We asked for written comments on the draft by close of business today on what more the federal government can do. We look forward to hearing more about that from our witnesses. Senator Murray.
Well, thank you.